Good afternoon to everyone and welcome to today's session. We have a very historical exam, the Bihar PGMAT, just like Karnataka PGMAT and AP PGMAT, Kerala PGMAT, etc. So, generally there is a lot of exchange of the questions between the various question banks. So, there is a reason it's worth discussing the other state PGMATs of the most recent happening, that of 2014, to include those questions. So we welcome our online students Akhil, Raghav, Shweta, Srinivas, Kiran, and the students of Vijayawada, Vizag and everywhere. While doing thoracosynthesis, it is preferable to introduce the needle. Where do you want to do? Very practical question. So doctor, it is the upper border of the lower rib, because the lower border of the upper rib is the place where your vessels will be passing, intercostal artery, vein and nerve. That's the reason we put it on the upper border of the lower rib in the intercostal space is what we will basically do. What are the contents of pudendal canal? So, we have internal pudendal artery, internal pudendal vein and pudendal nerve, which are the part of the pudendal canal, is what you need to remember. How will be the sensory fibers from the taste buds will be passing? We have the chorda tympani, which carries the taste sensation. But any sensory afferent going to sensory cortex has to pass through thalamus. That is the reason thalamus is called bedroom. Bedroom is the place where all senses will converge into. So that is the reason it is the thalamus is what you need to remember. Similarly, what can a similar question can come? All efferentiation, motor output will pass through pons is what you need to remember. Where will parotid duct will be opening into? It will be opening into the upper second molar is what you need to remember. Upper second molar. Then dorsalis pedis artery typically is a continuation of what? It is a continuation of anterior tibial artery is what you need to remember. Most of the times a state MD entrance will be like simple questions, sweet questions, but actual leg pulling will be there in 20-30 questions will decide the ultimate outcome. So that is how most of the state MD entrances are basically fixed at. So 160-170 questions, effortlessly you must be in a position to basically manage. Where is the testosterone is basically produced is a very important question. It is produced in the the testosterone is produced in the Leydig cells. So answer must be altered. By mistake we typing mistake. So Leydig cells. Between LH and FSH, which will control the Leydig cells? LH. LH receptors will be there on the Leydig cells. Then inhibin and anti-Mullerian hormone, where are they produced is going to be the next MCQ in the future entrance in Bihar PGMAT. So it will be from Sertoli cells is what you need to remember. What is the normal intracellular potassium level? Simple question. 3.5 to 5.3 milliequivalents per liter is what you need to remember. Oh, this is extracellular value. Okay, accepted. We need to alter the. It is intracellular compartment given. No, okay. We will alter the answer. Agreed. Now, what is the primary force which is moving the water molecules? It is the filtration, which is the thing which is basically moving. You have all the Starling forces, no? Oncotic pressure holds the fluid inside the vessel. Similarly, you are having we say glomerular filtration. What is the meaning of filtration ultimately? It is the balance between oncotic pressure versus interstitial fluid pressure. So it is a ultimate outcome of all these multiple pressures. Now, which has the slowest conduction velocity? This is another very favorite MCQ, any entrance you go, okay. So, it is not, C is not the answer, D is the answer. I think there were some good number of typographic errors in the key, but conceptually there will not be much of errors, don't worry. So, unmyelinated C fibers are the ones which will be most slow conducting in nature, is what you need to remember. The cross bridges of the sarcomere of a skeletal muscle, what is it basically made up of? It is made up of myosin. So here you are having a light band and a dark band, and the myosin and the actin. So it is the myosin is what you need to remember. What is a lysosomal storage disorder? Once more, if you take the AIMS November 2014 paper, you remember the similar question was asked, which is a glycogen storage disorder, McArdle's, etc., etc. So there is a reason, lot of commonness in the way questions are asked. Tay-Sachs disease is what you need to remember. So Tay-Sachs is called gangliosidosis, where GM2 ganglioside is the one which basically deposits. Now, whenever you are doing urine analysis of obstructive jaundice, how can you be able to differentiate obstructive from that of the hemolytic jaundice or hepatocellular jaundice? Typically the bilirubin enters into intestine and there it is converted into urobilinogen. If there is an obstruction, if the bile duct obstruction is there, in the liver whatever the bilirubin is there, it cannot enter into intestine. So unless it enter into intestine, it can't be converted into urobilinogen. There's a reason presence of urobilinogen in the urine means there is no obstruction. Absence of the urobilinogen in the urine means presence of obstruction. So that's how urobilinogen is the differentiator, is what you need to remember. So I lead to you in the literature, pre-hepatic, hepatic and post-hepatic jaundice, how do you basically differentiate? How will you assay the hormones is a very, very important question. Very, very important question. Very good. Shweta is saying potassium level, what would be the correct answer? The answer we gave was of the extracellular. Intracellular values are at least 50 times higher than that of extracellular value, around 150. Now, hormones, how do you assay them? You have, how many of you answered radioimmunoassay? I know. If you take sensitivity, specificity, ELISA is much more sensitive method of assessment rather than radioimmunoassay. That's the reason that becomes the answer. Pellagra Institute, easiest question in the world. And what is that amino aciduria and a tubular defect where you find pellagra? Hartnum's disease is the place where you have amino aciduria. Which enzyme has zinc? I think today's question paper you are all very happy, right? Simple, sweet paper. This is what is supposed to come, single liners. Okay, day after tomorrow we will have JIPMER discussion. Please all of you come. I'll be very happy to see you all. We'll have it. Now our guns are taking the exam in Pondicherry. JIPMER 2014 this time came like a preterm labor in November only. Generally it is in the month of February. So we'll have a discussion of that. That will help you to add up some more questions to your expected question bank. So that's the whole purpose. So doctor, it is carbonic anhydrase, answer D, where you have zinc as the important element. Neutropenia plus pancreatic insufficiency. One question, any entrance you go, it will come on immunodeficiency disorders. Job syndrome, Chediak-Higashi syndrome, then the various types of common syndrome. So, what do you have in Schwann-Diamond? You have exocrine pancreatic insufficiency along with neutropenia, metaphyseal dysostosis and failure to thrive and short stature. So, skeletal abnormalities are also part of Schwann-Diamond syndrome is what you need to remember. Which organism is very frequent in cystic fibrosis? Pseudomonas is the organism which you need to remember. So, what are all the capsulated organisms in the microbiology textbook? So, if you take E. coli, Klebsiella, Haemophilus, Neisseria, Pseudomonas and Cryptococcus among fungi, they are all basically capsulated. Vibrio is not capsulated, that is the point. Now, dark ground microscopy is used for identification of what? This is another very repeatedly asked MCQ in the All India MD entrance. So, you must be quite sure it is the flagellae which are identified. How many of you answered Fimbriae? There are minor temptations. We need to get over all that, because old question bank based questions, if you answered wrong means competition is ruthless. They will stampede you. That's important. Why don't you say capsule? You can't see capsule on dark ground microscope. Dark ground means spirochetes and all that you will see, no? Dark ground microscopy may spirochetes, if the flagellae are there, they will be very refractile on the dark ground microscopy. So, flagellae are the organs of locomotion, as all of you know. You have peritrichus like typhoid, then monotrichus like cholera, lophotrichus like spirilla. Even this can be a future question. So, Bihar means Patna, Patna means Ganga, Ganga means behti hai. Immunoglobulin G behti hai, it will cross the placenta. IgM doesn't cross the placenta. That's what you need to basically remember. So, regarding interferon, what is the special feature of interferon? Very fundamental MCQ in Bihar PGMAT. So, doctor, it is species specific. It is not bacteria specific or virus specific, but the species specific is what you need to basically appreciate. Now, what are the drugs that lead to hyperglycemia? So, there is one drug out of all this which lead to hypo instead of hyperglycemia. Which one, doctor? Pentamidine. Typically is responsible for hypoglycemia is what you need to remember. What are all the list of drugs that lead to disulfiram reaction? This is called stock MCQ. Any entrance you go, it is like, do you know the secret code of standard MCQs or not, is the question. So, don't forget, doctor, you can remember PM, PMT, pre-medical test in the PM, procarbazine, metronidazole, and among cephalosporins, never forget, favorite question, straight it will come like a printing repeat in the next exam. Cefoperazone, cefomandel, cefotiton are the three cephalosporins associated with disulfiram reaction is what you need to remember. Here comes the common question. Yesterday evening we had a long discussion on diabetes in our medicine class. Today evening once more we have a medicine class. Please do come. We'll finish endocrinology and pulmonology. That's the plan. शॉर्ट एक्टिंग इंसुलिन्स, इंटरमीडिएट एक्टिंग इंसुलिन्स, लॉन्ग एक्टिंग इंसुलिन्स आपको लिस्ट तो टिप्स में रहना, because there is a minimum expectation of the examiner from a MBBS pass out. Lispro, aspat, glulisin, rapid acting. Aspat में asparatin, asparagine, asparatic acid will be there. Altered position will be there in the structure of aspat. If you missed our yesterday class, you have it available in the online video library at anatomy2medicine.com. So you can always revise that. But one question, any entrance you go will come, and JIPMER also day after tomorrow when we discuss, you will have a question on one of the diabetic drugs. Short acting insulin is which one? Regular insulin. And intermediate acting insulin is protamine containing NPH insulin. Long acting will be, you give one shot, 24 hours it will work. Glargine and Detamir are the long acting insulins is what you need to remember. Iprosidate and diflunisal, what are they basically? If the same question comes in next AP PG or Kerala PG, don't tell that I leaked you. So it has a high chance of coming. So doctor, iprosidate and diflunisal, they are salicylate acid derivatives which have analgesic and anti-inflammatory activity. So they also will inhibit the production of the prostaglandins. And what are the main indications for using them? Osteoarthritis, rheumatoid arthritis, any tendinous injuries, inflammation, and very important, ATTR type of amyloidosis. Amyloidosis is a chronic inflammatory state. That's the reason their anti-inflammatory action will help to resolve the ATTR amyloidosis. But what is the general rule I told you which you can apply in this question? If you, honestly speaking, I too came to know what is diflunisal yesterday only while preparing for this discussion. If amyloidosis is in the options, what is the answer? Forget about what is the question. Answer will be amyloidosis, because examiner want to ask one question on amyloidosis. That's the reason please go through that 1132 topic list, high yield topic list to be published on newsformedico.com. Just if you know what is the names of the headings, you will be able to answer the questions. Topic, favorite hot topics क्या है, list मालूम है तो answer कर सकते. Now doctor, which is not antihypertensive? I think easiest question in the world. That if you know levodopa is Parkinsonism drug, Bihar PG will give you entry into PG medical seat. But this kind of questions won't decide the seat, doctor. What decides the seat? I'll tell you some questions, classical questions. एम्स नवंबर 2014 में रिसेंटली क्वेश्चन हम डिस्कस किए ना, प्रोटॉन पंप इनहिबिटर्स को हाफ लाइफ बहुत शॉर्ट रहता मगर इसका ड्यूरेशन ऑफ एक्शन बहुत लॉन्ग रहता. ऐसे क्यों होता? क्योंकि प्रोटॉन पंप इनहिबिटर्स व्हेनेवर दे इनहिबिट द प्रोटॉन पंप इन द stomach, they will do irreversible inhibition. So that is the reason even if the drug vanishes, its effect persists. So such drugs are called as hit and run drugs is what you have to basically remember. So their effect lasts longer than the drug itself. That becomes the hit and run drug. Myasthenia gravis, what do you have? So those who answered Bihar PGMAT before this recent AIMS definitely has an advantage of solving the AIMS November question correctly. So that way the history repeats. And acetylcholine receptor antibodies, postsynaptic receptors are there, no? So antibodies against them is a problem in myasthenia gravis. Coming to the collagen synthesis, what are all the factors that affect it? So basically infection, protein depletion, advancing age, all of them will affect. Then if you take anemia, Hematocrit, if it is greater than 15%, then it will not interfere the wound healing. That's the point you need to appreciate. Cystic fibrosis का जीन कौन सा नंबर क्रोमोसोम के ऊपर रहेगा? So commonly there are about some 15 to 20 classical chromosome numbers which are asked in exam. Wilms tumor chromosome number क्या होता? Wilson's disease का क्या होता? Hemochromatosis का कहाँ है chromosome number? Then APC gene is it on short arm or long arm of the chromosome number, whatever the number. So you must make that list of just 20 commonly asked chromosome numbers. But we will publish a list of definitely going to be asked chromosome numbers, not more than 20 that you need to mug and go to the exam. On the News for Medico, we will raise a blog page. You can have a review. Now, CFTR gene, doctor, it is typically located on the chromosome number 7 is what you need to remember. Okay. Most common origin of the melanoma kahan se aayega? Melanoma comes from the junctional melanocytes. So when it is junctional, it presents like a maculopapular lesion. When it become compound, it become papule, and when it become intradermal, then it become a nodule. That's how the melanoma will be evolving. Now doctor, spinal cord tumors we discussed in our, it is one of the top high yielding topics in our 1132 topic list. Spinal cord tumors, intramedullary. Then inside the spinal cord what you have? Intramedullary. Then outside the spinal cord but inside the dura you call intradural extramedullary. Then outside the dura which is compressing the dura you call it as extramedullary extradural. So that is what you need to remember. It is the metastasis which come to the spine are the ones which are responsible for most of the times extramedullary extradural is what need to be remembered. What are all the lesions that lead to intramedullary? Astrocytoma, glioma, ependymoma are the ones which are intramedullary. Then extramedullary but intradural, which one? Meningioma, neurofibroma are the ones which are responsible. So this favorite question of the examiner. Next Bihar PGMAT 2015 में क्या आएगा? Cauda equina और Cordus medullaris के बीच में क्या फर्क है? ये क्वेश्चन तो जरूर आएगा because examiners question bank में that is the buzzword. That is a buzzword which is sitting. Okay, so you need to review that. So what is the commonest site for a meningocele doctor? Lumbosacral area, classically. Okay. Then echinocandins. Actually, this is not a forensic question. Echinocandins. What are they basically? Capsofungin. Then micafungin. All these fungins are called echinocandins. They are basically antifungal in action. They will interfere with the cell wall of production of the fungi. So that's the reason it is a antifungal is what you need to remember. The overall survival will improve if you use a screening test like colonoscopy and fecal blood test FBT. In which tumor? In case of the colon cancer. Ovarian cancer ko screening impossible hai, right? Then they did lot of studies, lung cancer, prostate cancer, by doing prostate specific antigen and repeated chest x-rays. Will they to use? No, it will only help diagnostic center to become rich. It won't help really the patient. That's what they have decided. Then doctor, what is meant by Epworth scale? Typically it's called Epworth's sleepiness scale, it is called as. It is the one which is used to identify the people who are having sleep apnea. Suppose if you are having sleep apneic episodes, then every time apnea comes, there is an interruption in the sleep and the patient wakes up. Almost 70-80 times there will be interruption in the sleep in the night in the apneic people. So in the morning time, what do they develop? Daytime somnolence they will develop. So that is assessed by doing the Epworth sleepiness scale is what you need to basically remember. Actually during the MD PG preparation, what is the general routine of us? Morning 8 to 1 o'clock पढ़ाओ और 1 o'clock मेस को जाके थोड़ा खाके 2 बजे आके जरा लेट के 3:30 बजे या 4 बजे उठना. Like the LKG, UKG, PP1, PP2 में sleeping period will be there, no? So we will wake up at 4 o'clock, have a cup of tea, another 3-4 hours पढ़ के somebody will decide by evening 6 o'clock आज सेकेंड शो को जाना या फर्स्ट शो को जाना या कहां जाना रात को. तो have a fun in the late evening, party hard in the night, and once more come back to next day. Happy time, no responsibilities, nothing. Okay, but when you join PG, almost 6 months afternoon sleep आदत हो जाता reading room का. So typically in the post graduation, afternoons are for the journal club and case presentations and all that. It will take 1 to 2 months before you overcome that afternoon drowsy state. Not 1 to 2 months. If it is 1 to 2 months, your chief will fire you, unless he is also having afternoon sleeping habit. So Epworth sleepiness scale. Okay. Best method for sterilizing disposable syringes. I still remember one of our classmates saying, अरे यहाँ ये post graduation में कहाँ आ गए हम, कितना happy था वो दिन, तो वो सब चले गए क्या? Am I really dreaming or still I am entrance preparing kind of a feeling in PG? So best method of sterilizing disposable syringes will be by gamma rays is what you need to remember. For an acute attack of migraine, is the migraine is a high yielding topic? Headache is a very high yielding topic. Without headache, there will be no question paper. Okay, doc? So, typically triptans, almotriptan is the one which is considered to be used in the acute phase. Aplastic anemia, another very high yielding topic in medicine topic list. There is 112 topics in medicine. 112 topics in medicine. How many hours you will take? Hardly you will take not more than 30 hours to revise them. Okay. So we kept all the medicine notes as a downloadable in the download section of newsformedico.com. You can happily download the PDF and can be able to view it on your mobile phone also. And for the password you can call the helpline and then take a password. It will be a free password given to anybody. Now all notes, ophthalmology, ENT, pediatrics, orthopedics, everything we are uploading as a free PDF as a download. Knowledge is for free most of the times, should be. So in a young patient with aplastic anemia, typically it is a bone marrow transplantation. What type of bone marrow transplantation, doctor? It is called as HLA matched sibling donor HCT is the one which is considered to be the best way. But in all the conditions there is a raised anion gap. One question on acid base disturbances and one MCQ will definitely come on hypokalemia, natremia, calcemia, magnesemia. So doctor, diabetic ketoacidosis, uremia in renal failure, antifreeze ingestion, ethylene glycol, anything can lead to development of raised anion gap. Mud piles is the way to remember. Methanol, ethylene glycol, propylene glycol, lactic acid, uremia, aspirin, fenformin, etc. etc. What is meant by Conn syndrome? Conn syndrome होता है primary hyperaldosteronism, where adenoma is producing excess aldosterone. Then what is meant by secondary hyperaldosteronism? Suppose if you have congestive heart failure or pedal edema or ascites or dehydration, then whenever you have these situations, the renal plasma flow diminishes. That will stimulate kidney to release renin, that lead to angiotensin, that lead to aldosterone production. That is called secondary hyperaldosteronism. So the presence of edema suggests it is a secondary, not a primary hyperaldosteronism. So edema should not be there. Still person's aldosterone is high means his adrenal is having a adenoma which is producing aldosterone. That is the meaning of it. Okay, that's the point, doctor. A young lady, spontaneous abortions, triad of features. Thrombosis is there in the leg. APTT is prolonged. So when will you find all this? This is typical feature of antiphospholipid antibody syndrome. Basically that antiphospholipid antibody, what will it do to the APTT? APTT we will do in vitro assessment in the lab. So it will interfere with that in vitro, not in vivo, in vitro. That is the reason you will get a APTT significantly prolonged. Normal APTT will be around somewhere 35 or so. It will be 150, 220 like that. Big number will come for APTT. Laboratory may. But patient will have what tendency? Not bleeding diathesis, thrombotic tendency. Then a thrombotic tendency patient may, what is the treatment you will give? Heparin. How will you monitor heparin? Using APTT. But can you use APTT for monitoring heparin if it is antiphospholipid antibody syndrome patient? No. That is the challenge of the case. Okay. How will you still give heparin without depending on APTT in a patient who is having thrombotic tendency due to antiphospholipid antibody syndrome? How many didn't understand? Raise hand. Bilkul. You didn't understand? You understood? Sure? Or am I going in ozone layer? No, no? That's what. So, because now you are all exam going, PGs. Exam going postgraduates. So that's the reason I am trying to go, assuming you know a lot of things. And in fact, you know. Now, X-ray shows notching of ribs. I think easiest question in the world. Coarctation of aorta. There is a pleural effusion. What is the best place for you to tap? Typically, in the mid-axillary line, in the 8th, 9th and 10th intercostal space. The nearest value will be option C. Right? Any other alternative answer you thought? Wrong answer. What is the famous wrong answer? Okay. This is the question I am waiting, doctor. This will definitely be asked in the next AP entrance and All India entrance. Why? Because JNC 8 guidelines were proposed in 2014. Joint National Committee is a international body that will do a MAT analysis on various studies, and then it will give recommendation of what is good and bad for management of hypertension, which is the most common problem across the globe. Right? So, how is JNC 8 different from JNC 7? Okay? You must be very sure. Let us master this, because when the same question comes in the next JIPMER or in APPG, you will remember me in exam hall, right? All patients, what is the diastolic permitted? Generally normal diastolic BP is 80, it is permitted up to 90. Then how much systolic is permitted? Between 18 to 59, or if there is diabetes or a chronic kidney disease. In all this subset of population, up to 140 is permitted. But if the age is more than 60, they said you permit the systolic BP up to 150 is acceptable. Earlier JNC 7 mein they said anybody 120 bring it down. Now 150 tak permission de diya. Okay? So what is the answer, doctor? It is 150 by 90 is what you need to remember. Then suppose if there is a patient of 18 to 59 of age without any major comorbidities, and in a patient who is 60 years of age or older who have diabetes, chronic kidney disease or both, No, the earlier chart is the correct one. The earlier, where is the chart? 1 minute. So systolic BP age more than 60 is 150. That you need to remember. That's more important. There are few more recommendations given by JNC8. What are they? What are the drugs you can use as the first line drugs? एक BP पेशेंट आ गया, उसको शुरुआत करने के लिए कौन सा दवा इस्तेमाल कर सकते हैं आप? Thiazide diuretics, calcium channel blockers, ACE inhibitors, ARBs. Losartan you can give, enalapril you can give, verapamil diltiazem you can give, thiazide you can give. What is not included in this? Our temptation is to give beta blockers. That is, they said no, don't give beta blockers at the first line. That is the new recommendation. Then what drugs you can use at the second and third line? You can give combinations. First line means only one drug. Second line and third alternatives are combinations. In combinations also you can use ACE inhibitor, ARBs, thiazides and calcium channel blockers. इसमें भी beta blocker नहीं है. तो beta blocker को ले जाके कहाँ लगाया? JNC8 में. It is considered to be now as a later line alternative. अगर इन चीजों के साथ काम नहीं हो रहे, बीपी कंट्रोल में नहीं आ रहे, तब आप बीटा ब्लॉकर्स को इस्तेमाल करो बोले. बीटा ब्लॉकर्स आर गिवन इन लास्ट प्लेस. So beta blockers, alpha blockers and vasodilating beta blockers are centrally acting drugs like clonidine, or a direct vasodilators like hydralazine, loop diuretics like furosemide. They are all placed in the later line drugs is what need to be remembered. Suppose if the patient is of an African descent, our Indian statistics match more closer to the Africans. Asians and Africans are very close in their epidemiological constitution. So African descent without chronic kidney disease, what is the drug you want to use? Calcium channel blocker and thiazides. Earlier they were saying give ACE inhibitor. Agar if he is a black, give ACE inhibitors is a preferable first line drug. But now they said no, you give calcium channel blockers and thiazides. Then with subset of populations they said don't forget to prescribe ACE inhibitor. Don't forget to prescribe. You have to prescribe. Kisme? Typically if there is a chronic kidney disease, whatever be the ethnic background, if chronic kidney disease is there, you have to basically give it as a first line therapy is what need to be remembered. Then earlier they were saying losartan diye to enalapril bhi de sakte. You can give losartan plus enalapril, ACE inhibitor and angiotensin receptor blocker plus ACE inhibitor. But now the recommendation says don't give them together is what you need to basically remember. Then suppose if the patient is above 75 and he has got an impaired renal function, then what is the most important principle? Don't give ACE inhibitors or ARBs, because if you give ACE inhibitors or ARBs in a patient more than 75 years age who has got renal dysfunction, then hyperkalemia, renal failure, all these things are the complications. That's the reason give calcium channel blockers and thiazide diuretics. So examiner, if he really puts up his sleeve to set up the new questions to check whom to be given PG seat, he will definitely go through this JNC8 recommendations and frame the MCQs. A 78-year-old individual has come, his creatinine is, he won't say about creatinine also. What is the first line therapy you want to give, or what should not be given among the following as the first line therapy? If you have not chosen ACE inhibitor, you are out of the game, right? So that's what you need to remember. So what is the preferred thing under hypertension guidelines, doctor? ACE inhibitors, ARBs, calcium channel blocker, thiazides, but not beta blockers. You can combine ACE inhibitors plus calcium channel blockers, ACE inhibitors plus thiazides, or any combination, but not ACE inhibitors plus ARBs is the second important point to remember. Beta blockers are not preferred is the next important point to be noted. If the patient is having CKD and less than 75 years, then ACE inhibitors are ARBs, but above 75 don't give ACE inhibitors or ARBs. Then if he is African descent without CKD, then calcium channel blockers and thiazides are the ones which are preferred, is what you need to remember. Okay, doctor? So just revise it once more. I gave all that in the literature to you. Now you are inserting a central venous catheter, respiratory distress aa gaya because your needle has punctured the apex of the pleura of the lung and pneumothorax has happened. Then what is the SI system of blood pressure? They are all expecting radioactivity may Curie's, Becquerels, and suddenly examiner sprouts a unexpected question to you. What will you answer? Kilopascals are basically the SI units. Probably the physics we studied, units, dimensions, first chapter in physics will be of some use here. EEG, are you ready with the EEG waves? Sleeping mein kya hota, waking mein kya hota, alert state mein kya hota, etc., etc. If you answer this question wrong, doctor, this become more severe grievance. Suppose if a percentile based exam is there, like All India MD, majority will answer this wrong and you have answered this, majority will answer this right, you have answered this wrong, then your wrong become a bigger wrong. Percentile scoring jahan hota hai. Okay. Suppose if a rare question is there, your Schwann diamond syndrome was there, no, that question. अगर percentile based exam like All India है, आपके दोस्त भी आंसर करना रेयर होता है, आप भी आंसर करना कैसे भी रेयर है, तो दोनों रॉन्ग करने वाले हैं तो आपका रॉन्ग छोटा रॉन्ग हो जाता, right? If you are a thief in the bunch of thieves, theft is considered to be the rule of the day, but you are not like that. If you are in the ruling state and if you do theft, that is a bigger crime, that way. So doctor, alpha waves, beta waves, theta waves, delta waves, don't forget to revise today only if you have forgotten to do that. Checklist to carry to All India PG exam. Hypertension with hypokalemia typically occur whenever aldosterone levels are high. Normally what will aldosterone will do? Retention of sodium and loss of potassium into urine. High aldosterone will lead to excess loss of potassium into urine and that lead to development of severe hypokalemia. So in all these situations you have that, but if you take renal disease is a state of potassium phosphate retention, hyperphosphatemia, hyperkalemia, that is what you will basically come across. Necrobiosis lipoidica is a feature of the diabetes mellitus. Then minimum abnormal hemoglobin required to produce cyanosis, हर एक type of hemoglobin को एक value है. So what are those values? You must be quite sure, doctor. Suppose if you take reduced hemoglobin, minimum 5 grams must be there for cyanosis to happen. If you take methemoglobin, minimum 2 grams must be there. And if you take sulfa hemoglobin, a minimum 0.5 grams must be there for the cyanosis to appear, is what you need to remember. Whenever periodic paralysis is there, it is due to generally either hyperkalemia or hypokalemia or calcium abnormalities. So that is the reason, how do you generally treat? Potassium chloride is the preferred agent which you can give in an acute attack. How will a hypokalemic periodic paralysis patient will present to you, doctor? He will